Hi, my name is Irene. I'm an ER nurse here in Utah. I'm creating this channel because you've seen a lot of scary things in the media and on social media, and I just want to bring into light what's going on here in Utah. Where are we at right now? Are we in the thick of it? Are we almost done? Or are we just beginning? So in the end, I have an interview with all of my coworkers, well, most of them, and I asked 4 questions. One of the questions I asked was, how do you feel right now working here in the ER or hospital? And the second question is, how do you think it's going to be in a few weeks? The third question is, how do you think the world is? And then the final question is, what is your message to people watching this? I'm also taking the time to do kind of an experiment here from what I see on Facebook, because I am part of the social media with nurses on Facebook, and a lot of them have had some concerns about wearing scrubs out in public. One of the nurses was smacked, punched, hit, so I really want to bring that into light. Hello everyone, I am actually on call today. I worked the past few days, and the big hot topic that's going on right now is healthcare workers going to the stores with their scrubs on. So I actually do have to go to the store today, and I just want to see the reactions and see if in fact there is a stigma towards healthcare workers, and we'll see how it goes. All right, I just got back from the experiment, and what did I learn from this? Well, I learned that people are just not only scared of me, but scared of each other right now. Yeah, I got glances here and there, but then they were also looking at each other, making sure that they weren't too close to people. So of course, here in Utah, we have a great community. They are very welcoming and hospitable, and I believe that for the most part, most Utahns are very caring. So I didn't get any mean looks or prejudices, or obviously I didn't get hit. That's a good thing, right? But so the looks on people's faces were more of concern with just the world right now and what's going on. I'm sure they were just going out to get what they needed and head back home to their loved ones. And I really didn't see the fear that I was worried I'd see. So for the most part, they were treating people with decency and respect, which I was very, very glad to see. Healthcare worker violence is real. It happened even before this pandemic started. I am a victim of healthcare worker violence. A few years back, I was kicked by one of my patients, and I had a finger broken and was out for a bit. So it's there, it's real. We need to bring more light into healthcare violence. We are the ones putting our lives at risk for you right now. Most hospitals right now won't even allow you to have a family member there with you. Maybe one family member. If you're in being admitted, you have no visitors available, unless, of course, you're a child and you have one parent. But there's no one there for you but us. We're also the ones that are probably there with, your loved ones when they take their last breath. So do us a favor and provide us the compassion that we provide for you. So my answers to the 4 questions, the first one being, how am I feeling right now? Well, how I'm feeling right now is a lot of anxiety with being in the front line, taking it home to my family and making them sick. I'm very confident with the hospital I work in right now. They've been very good to us. They've made sure that the lines of communication are open especially when we need to talk to someone about our feelings with this whole situation going on in the world or in our hospital. They've been very, very good about ensuring that we have PPE. I have a wonderful manager that even went to bat for us, and at one point had us have the opportunity to have scrubs we can actually change into in the ER. So I think because she was even able to do that, I have confidence that she'll be able to do more for us when it does get crazy. My second question was, how do I think it's going to be in a few weeks? Well, I think in a few weeks, it will definitely be a lot busier in the ER, in the hospital. But I think they did a really good job here with implementing the social distancing a lot sooner than they did in New York and other places. I too believe that New York and other hot spots in our country were hit really fast, and the social distancing and all the measures weren't put into place, and it was a little too late. And that's why we're seeing the numbers growing there, and they're basically playing catch up. Here, I think we're more spread out, and hopefully we have the opportunity to flatten that curve. My thoughts on how the world is acting right now. Well, it's crazy. It's chaotic. People are scared. We're scared, but I've also seen the community here, especially in Utah, go out of their way to make sure we have food in the hospitals during these chaotic times. I can't tell you how many times people have donated food, bringing us cookies, bringing us pizza, bringing us sandwiches, meals, even meals for our family at home. And the messages I've been getting from some of our friends and family that have checked on us and been concerned and just reaching out by texts or emails is tremendous. If anything, this has brought us together. People that we haven't talked to in forever have reached out, and I think that's our strength, and that's our world right now. Now the fourth question is, what's my message? My message is, be good to everyone, even after this. You saw that we can be tested as a community, as a world, but we can also come together, and we will just become stronger after this, and we will get through this. And be good to your healthcare workers, because we are the ones holding your hands right now during this vulnerable time in your lives. Introduce yourself.
I'm Dr. Hansen. I work in an emergency department.
And how are you feeling right now in the emergency department?
Great question. Right now I feel fine. I feel okay. It seems like our numbers are low. I think we're able to kind of manage the flow of patients really well right now. I think people are listening to the message that our government leaders and our medical leaders have said to stay home and to not come unless you're really critical. And I guess fortunately we haven't been seeing a whole lot of numbers, and I guess unfortunately that's we're cutting hours and cutting staff a little bit, but I think this is kind of the calm before the storm.
Okay, and how do you think that it's going to be in the next few weeks to a month?
Gosh, I think it could get scary. I think that if we look at the examples and what other states are going through right now, I think there's a chance that this could ramp up really, really quickly. And I think they're predicting that in maybe the next 2 or 3 weeks that we should reach that kind of that rush. And the question is do we have the capacity to manage that? And we just hope that all this social distancing has helped so that that rush isn't as critical as it has been in other states.
And how do you think the world is doing right now, or acting, or?
I think that, I like to focus on the good that's happening. And like I look at my family, there's been so many people that have reached out to me and my family through text message, through phone calls, through direct messages, and I've just been blown away at the kindness. Just to give you an example, some neighbors dropped off a care package on our front porch.
Aww.
Just had some nice treats in it, and so it's nice to see people kind of banding together and kind of helping each other through this difficult time. I think there are some people that are really struggling, and there's some things that aren't going well right now, but I like to focus on the positive.
And what do you want to tell your viewers that are watching you right now?
I would just say keep up with social distancing, keep up with your good hand hygiene, and keep up staying at home. I think it's really helping, and I think it has the potential to help a lot of people if we continue to do it. The problem is as we get warmer weather, the temptation is to go outside and to forget about social distancing. But I would just say just stay positive, look for the good, and also look for ways that you can serve other people, and that will help.
Awesome, thank you.
You bet.
All right, hi, introduce yourself.
Hi, I'm Mo. I'm an emergency room nurse working in Utah.
And how are you feeling right now, Mo?
I'm doing okay. I think that things are starting to feel like it's getting real here in Utah, so just a little anxious.
All right, how do you think it's going to be in a few weeks to a month?
So I have a feeling it's going to get worse.
Okay. And can you elaborate on that a little more?
Just being where we are and watching New York and Miami and LA and Washington and Texas, and just seeing how everything is just kind of slowly creeping in towards us. I think we're just a little bit behind them.
All right. And how do you think the world is acting right now or doing?
Well, I think the people in Utah have been acting a little crazy, especially at the grocery store a couple weeks ago when this first started to come out. And I remember being at the grocery store just because I was there and people were taking everything off the shelves. So I thought that was a little overkill.
All right. And what is your message to the viewers who are watching this right now?
So like everybody else, I apologize, I have to move this. Like everybody else, I mean, the message to stay safe and to stay home because we want to flatten the curve. But I just wanted to add that by doing that, if we can flatten that curve, then we're not going to experience what the other states are going through. And that now more than ever, we need to kind of demonstrate responsibility and love for life. And we need to show respect to ourselves and to our families and to our country.
Awesome. Thank you, Mo.
You're welcome.
Hi, my name is Emilia. I'm an environmental service technician. I work at in the ED
All right.
room.
And how are you feeling right now, Amelia?
I'm feeling great. I love being a part of a team that helps people get better, and that's what we do here.
Okay. And how do you think it's going to be in the next few weeks?
I think it's going to be great. As long as we're prepared, we should be okay. And we are prepared, so if we're prepared, then we shouldn't be scared. And we're taking the measures to ensure that our patients are safe, and yeah.
Okay.
So
And how do you think the world is right now with everything going on?
I think the world is very confused, and they have every right to be. It's scary. It's the unknown scares people, but I think this will teach us a lesson to really appreciate what we have, and really get close to our loved ones, and at the end we don't really need that much to be happy.
Great.
So,
And what's your message to people who are watching this right now?
just wash your hands.
Wash your hands.
And then, respect the social distancing. I know it's hard, and especially for our loved ones that live that don't live close to us, but just trying to stay safe and positive, because I think that if we have a positive attitude, then that should help us get through this. We will get through this. I'm pretty sure, and I have faith, and yeah.
Thank
We
you,
can do it.
Amelia.
You're welcome.
Hey, introduce yourself.
Hi, I'm Roxanne. I am a nurse in the emergency department in Utah.
And how are you feeling right now working here?
I feel pretty good. It hasn't been that crazy, and we've had a few sick people, but for the most part, I think we have a good plan in place, so it's been fine.
All right. How do you think it's going to be in a few weeks?
I think in a couple of weeks, we're going to get the bulk of the patients. I think we're a couple of weeks behind, like New York and some of the big cities, so we're starting each day to see a few more respiratory things, so I think that it is going to get worse in the next couple of weeks.
All right. And then how do you think it is right now in the world?
I think everybody's pretty scared and not knowing what to do, and I feel like a lot of it is just from the media's put a lot of hype into it, and I think if everybody just does what is asked, like wash your hands, stay home, and that it'll all be okay.
All right. And what is your message out here to the viewers that are watching this right now?
I think enjoy this time that you're be able to be home with your family, and there's no other things that you can do other than just stay home and enjoy each other's company, and just know that it came to pass, not to stay. So just enjoy.
Awesome. Thanks, Roxanne.
You're welcome.
Introduce yourself.
Hi, I'm Emily. I'm a pharmacist.
All right. And how are you feeling right now, Emily, in the hospital?
I'm feeling good. We've taken a lot of precautions, and I think everybody is as obsessive about sanitizing everything as I am. So we just are constantly cleaning things and working hard. We've trained for this, and we're happy to be here and help.
All right. And how do you think it's going to be in the next few weeks to a month?
I anticipate it getting worse just because that's been the trend everywhere else, but I do know that Utah has taken steps sooner than a lot of other places, so I think we're in a good position to stay below the numbers of everywhere else.
All right. And how do you think the world is right now?
I think there's probably a lot of places that are on the downhill side of this. We'll probably go up for a little while more, but I've heard a lot of good stories about a lot of people helping, and I think if we just stay home and sanitize everything, we're gonna get through this.
And what do you have to say to all the people watching right now?
Wash your hands for at least 20 seconds. I sit and sing the ABCs while I'm washing my hands.
Or happy birthday.
Yes. So just be careful. Try and stay away from people. I know it's hard, but do your part and protect us all by staying 6 feet away.
Thank you, Emily. Introduce
Hello.
yourself. Yeah.
My name is Willie. I am a housekeeper,
Okay.
and I am very happy to be here helping the other people.
Okay. And how do you feel right now working here?
I feel great. I feel safe. I guess we're doing good. Good job.
And what about in the next few weeks? How do you think it's going to be?
I hope it's not worse, but I feel like it's gonna be okay because everybody's taking care of each other, and then I guess we're gonna be safe.
Okay. And how do you think the world is right now? How do you think it is out there?
I know it's confused, and I guess people is just like afraid.
Yeah.
But we need to be calm down and feel like everything is gonna be okay, and don't get panic.
Okay. And what are you going to tell people who are watching right now, who are looking at this?
Yeah, just take precautions. Wash your hands, cover your face. Don't be too close to another people, and then just follow the instructions. And I guess everything is gonna be okay. Just don't get panic.
Don't get panicked. Thank you, Willie.
You're welcome.
Hi, my name is Chris. I work in the healthcare field. I'm a critical care tech in Utah.
Hey, Chris, how do you feel right now with everything going on?
So regarding the COVID-19 virus, currently I feel that our hospital has plenty, at least for the moment, of PPE, personal protective equipment, that is keeping us safe. That for the most part, our protocols are keeping the majority of us out of harm's way with this virus.
Great. And then what do you predict for the next couple weeks to month?
From what my understanding is of the virus, it's according to some of the bell curves and different theories and studies going on, that it's supposed to start peaking closer to the end of this month, which is April, and that it should start getting, our numbers should start doubling, tripling. We should start seeing a lot more respiratory illness coming through. And that's the part where I'm nervous and getting worried that when those loads of people start coming in, are we going to have the equipment necessary to A, keep ourselves safe, and B, treat our patients.
Great. And then how do you think the whole world is reacting, or Utah is reacting, or the whole world right now?
The world, I think Utah is definitely behind. The rest of the world seems to have gotten hit a lot faster, a lot harder. But with the death toll and the sickness that has started and spreading, I think the world is acting appropriately as far as our leaders are taking it seriously, and I think that's important. Some of us as people need to take some parts more seriously, the quarantine, staying away from others, just for this time, so that we can stop the virus spread, kind of flatten out that hump of the bell curve, so that our medical people can continue to have the resources necessary to fight the infection, kind of spread that out so that it's not all hitting all at once and piling too many patients. But definitely more people need to start understanding where it is important to worry and where it's not, because worrying too much is making things worse. So going out and buying all non-essential things, like we have patients coming in who can't give their babies Tylenol and ibuprofen and whatnot that they're looking for because they can't find any. So if people are going out there and just buying things unnecessarily, that's where the scare is going too far and is hurting people.
Okay. And what is your message to all the people who's watching right now?
For the most part, do your part of A, staying away from others, quarantine yourselves to help slow down the progression of this virus. B, do your best to educate yourself. Know where and when you need to come to a hospital. In the emergency room, you really shouldn't be coming in until you have an emergent situation, meaning you've taken your own pulse ox, O2 stats, finding that your oxygen saturation is getting below 90. That's the part where it's really starting to get scary. Until your saturation is that level or your vital signs are getting bad, you really have no need to come in for a viral infection, because there's nothing we can do. A viral infection, you just need to go home and wait it out. Coming here puts us at risk, puts yourself at risk for getting more sick and getting others sick. So general education.
Thank you, Chris.
Thanks.
Introduce yourself.
Hey, my name is Steve. I'm a registered nurse at a hospital in Utah.
All right. In what department?
I'm in the emergency department.
And how are you feeling right now, Steve?
You know, I'm feeling okay. It's a little overwhelming, not due to the amount of patients that we're seeing quite yet. It's just due to the amount of changes and processes. We're trying to keep up with everything to keep our staff safe, to keep patients safe. And as a result, there's just a lot to learn and a lot to be prepared for.
And how do you think it's going to be in a few weeks from now?
So hard to say. You know, like if I want to give you my honest answer, I'm just hoping that it's more of a steady growth, not an exponential growth. You know, you're seeing other areas of the world that have been affected by this exponential growth, where they see hundreds and thousands of patients just come into the ER over short periods of time, and they get overwhelmed. And if we could avoid that, I'm going to be happy. I think that so far Utah's done a pretty good job of preventing that from happening. It could be a matter of time until it actually happens. We're pretending or preparing, I guess, in a way that will reflect the second model, which is more of the amount of people coming in all at once, and we're trying to get prepared for that.
And how do you think the world is right now?
It depends on the area of the world, but it's funny because like every single community seems affected by this. And so I think that there's a lot of people who are just in disbelief. I've had a lot of people say that they are living Groundhog Day over and over, and it does feel like that. Every single day feels the same right now. If I'm not at work, then I'm confined to my home. I'm not going out into the community, and if I'm coming into work, it's pretty much the same shift over and over again. And so the world right now feels like it's in that same entrapment of just not being able to get out entirely, free themselves of this thing that is so greater and bigger than all of us, which is COVID.
All right, and then what do you have to say to the people that are watching this right now?
I think there have been so many other people who have already shared where they are in the process, and there's many people who are well ahead of where we are, and there are many people who are approaching where we currently are. And all I can say is it's challenging in every step because you have such a heightened awareness, new education processes. You are constantly monitoring every single move that you're doing to not cross-contaminate, to protect yourself, to protect others. And if there's one thing I want to share with others on that, it's just be persistent with it. We're all in this together, every single community in the world. And some people are more advanced in this experience than where we are currently. And I look to those people for guidance and support and counsel, and that's one thing that motivates me, is that I just want to learn from them and apply what they've learned to what we're doing right now.
Awesome. Thank you, Steve.
Yeah, you bet.
Hi, I'm Nikki. I work with Irene in the emergency department.
Hey, Nikki, how are you feeling right now?
Right this second, I feel okay. Things are good in the ED, but overall, things are stressful. I have times where I'm really stressed and scared. That someone that I work with is going to get it, or even just there's always this anxiety looming of when is the shoe going to drop? Is it just all of a sudden going to get crazy and overwhelming? And
all right, how do you think it's going to be in a few weeks?
In a few weeks, I expect it'll pick up as people start getting sicker. They'll probably end up here and then need more treatment and shipped off. And but I feel like, I don't know, and maybe this is more of a hope than a feeling. I hope that it's a manageable thing. I hope we're not overwhelmed. I'm obviously afraid of running out of PPE.
Right?
Yeah.
And how do you think the world is right now? How are they acting?
Well, I kind of have something funny. Can I read something funny?
Yeah, read something funny.
Okay, I gotta get up. Okay, so it says, imagine if 10 years ago you were approached by a time traveler and he was like, look, I don't have much time to explain. All I can tell you is that the year 2020 is going to be an absolute circus. You know Donald Trump, the star of The Apprentice? Well, he's the president of the United States, and at the beginning of 2020, he gets into a Twitter beef with Iran that almost starts World War III. Australia catches on fire, and a woman tries to save it by selling pictures of her boobs. Kobe Bryant passes away in a helicopter crash. Half the world is devastated. The other half just makes messed up memes. A little time passes, and just when the world starts recovering from the loss of Kobe, some dude in China eats a raw bat and starts a global pandemic that specifically kills mamas and papas. Everyone loses their mind. 40% of the population thinks it's the end of the world. Another 40% thinks it's all fake. And 20% blames the whole thing on cell phone towers and Tom Hanks kids. The one thing everyone seems to agree on is that the only way to survive is by hoarding toilet paper. Grocery stores are ransacked, and Charmin Ultra Soft essentially replaces the dollar as the United States official currency. Eventually, as hysteria grows, world governments are forced to shut the entire planet down and lock everyone in their houses, and the only person that can keep the people from completely flipping out and starting a huge riot is a gun-toting, mullet-sporting, homosexual Oklahoma man with a meth addiction and 180 pet tigers.
Oh my God. That is awesome. What is your message to people that are watching this right now?
Stay positive.
Yeah.
We're gonna get through it. Hopefully, hopefully you don't lose anyone close to you. Hopefully, but I have a feeling everybody's gonna be a little impacted by this, whether it's a family member or just taking care of it or financially, because the economy is, obviously taking a big hit because of this. But just try to stay positive, stay kind. Know people are helping others. I've seen it in my neighborhood, people helping other people and trying to be there for people. This is our time to come together, even if that just means not coming together physically. But just take care of each other, be kind.
Okay. Thank you, Nikki.
Yeah.
Introduce yourself.
I'm Nate. I'm an emergency physician in Utah.
All right. And how are you feeling right now working in the emergency room?
Everybody's a little stressed out, and we haven't seen our surge yet, so we're kind of in anticipation, but I think everybody's hopeful that maybe we'll be a little bit spared.
All right. And how do you think it's going to be in a few weeks from now?
That's the big question on everybody's mind. It could flare up. We're anticipating if we do get a surge, it's going to be in the next few weeks, so the next 30 days are crucial. But I think everybody's doing their part, so maybe we'll flatten that curve a little bit and see a little less mortality around here.
Awesome. And how do you think the world is right now?
Everybody's stressed. If you're not affected by COVID directly, then you probably are indirectly because of your job, lifestyle, everything's turned upside down.
And what do you have to tell the people who are watching this video right now?
Hang in there. It's temporary. This will blow over eventually and we'll all get back to our lives.
Awesome. Thank you, doctor.
Hey, I'm Megan.
Where do you work?
In the emergency department.
What state?
Utah.
Okay, how are you feeling right now, Megan?
I'm feeling pretty good.
Okay.
I feel like we have a great team here in our emergency department. I think we've practiced going through our protocols and all that, so I think we're ready.
All right, how do you think it's going to be when we hit our peak here in Utah?
I think it's going to be a stressful, scary time, but like I said, we have a great team here that works well together, and it'll be crazy, fun.
All right, and how do you think the world's acting, Utah or the whole world, or how do you think everyone's just acting right now?
I think we're a little behind. I think we should have shut down a while ago just to stop the spread of it. But all in all, I wish people would take it a little more seriously and stay home. You don't need to go out. You're only putting yourself and your family in danger.
What's your message if you had a message to tell everyone about this?
Slow down. Make sure, take care of yourself, protect yourself. That way you're protecting your family.
Thank you, Megan. Introduce yourself.
Hi, my name's Christian. I'm a critical care tech here in the ER.
All right, and how are you feeling right now working in the ER?
It's pretty stressful. It's just kind of hard. I don't know, it's kind of weird. A weird time, I guess, just kind of dealing with everything.
All right, and what about in a few weeks? How do you think it's going to be?
In a few weeks, I think it'll be worse, but we'll see. I think it hopefully gets better in the next few months, but we'll see.
All right, and how do you think the world is acting, or how the world is right now?
I think the world is just going crazy mode. I don't know, it's different. How everyone's acting, it's just kind of weird. People are freaking out. I think it's not needed as much, but we'll see.
All right, and what do you have to say to the viewers right now who are watching this?
Stay at home, be safe, and we'll get through it.
Awesome. Thank you, Christian.
Okay, my name's Karen. I am an ED nurse in Utah, and I'm feeling today a little tired and I'll admit a little anxious when I come to work every day, particularly if I've had several days off, because I'm not sure what it's going to look like when I walk in the door.
And how do you think it's going to be in a few weeks to a month?
I tend to be an optimist. I'm noticing, at least here in our emergency department, numbers are down. We're not seeing as many patients as we normally do, which makes me think that people are actually staying at home. So I would like to think in a couple weeks it's not going to be as bad as they're predicting it's going to be.
Great. And how do you think the world is acting right now?
I think it depends. Sometimes I think it depends on day to day, kind of how I think they're acting. Sometimes I'm impressed with sort of the kindness that you can see out there, that people are very altruistic, and then other times when I can't find any toilet paper, I think people are crazy.
I'm with you there. All right. And then what do you want to tell people that are watching this right now?
Be good to each other. I think right now everybody's sort of at this really heightened level of stress and anxiety, and it's so easy to sort of let that take over and just, be good to each other.
Thank you, Karen. Introduce yourself.
Hi, my name's Frank. I'm an emergency medicine resident currently.
All right. And how are you feeling right now working the hospitals and the ER?
We're definitely waiting for the spike of COVID cases here. I would say a little anxious, but we're feeling really well prepared.
And how do you think it's going to be in a few weeks to a month?
I think we're going to be much busier than we are right now in a few weeks. Hopefully in a month we'll be really well conditioned, have a lot of practice with this, and just be taking really good care of people.
And how do you think the world is right now?
Okay. There's definitely a lot of uncertainty. I think a lot of us are stressed in the healthcare field. We're worried about our families, worried about our coworkers. I still think there's a lot of hope, though, and there's a lot that we can control in terms of preventing disease being transmitted to ourselves or within our communities, and I find that reassuring.
All right, especially since you're getting into this right now, and do you have any feelings of like change now that you're with everything that's going on? Do you still feel the same about getting into this hectic world?
I think it shows me the exact reasons why I love the emergency department. There's obviously a little bit of concern and hesitancy as we have other academic requirements for our training that are being put on hold right now, but I think we're happy to help and be part of the workforce.
All right, and what do you have to say to people that are watching this right now from all over the world?
Okay, hang in there. We appreciate the trust that you've put in us, and we're relying on you to do your part as well, and keep washing your hands.
Awesome, thank you. Introduce yourself to our viewers.
Okay, I'm Nicole, and I work as an ER nurse.
Okay, and how are you feeling right now working in the ER in Utah?
I feel pretty good, but I feel a little nervous also. I feel like I have to be really careful. I feel like if there were more cases in Utah, that I would be more nervous that I would get the virus. But at this rate, I feel like I can handle it.
Okay. And what do you think it's going to be like when we hit our peak here in Utah?
I don't know. I think it could go either way. I think that it could get much worse here, but then it also could level off and go down. Like New York City has people in closer proximity. So I can see that theirs is ballooned and may balloon much worse than ours ever will. So I'm kind of hoping that our numbers will increase to a certain point, but not as bad as the east side of the country, and then go down.
Okay.
So.
And then how do you think the world's reacting or Utah's reacting right now?
I think Utah, I'm really proud of Utah. I think Utah has done a good job, closing the schools early and doing the quarantining much sooner than other places. I think the world is reacting in a very nervous way because of the international travel, and I think they're also nervous about the economy, and what it will do to the economy. So I think that's probably how they're reacting.
And what is your message to everyone?
I would say stay positive, think about the previous pandemics and read about history, because those pandemics did end and we were able to get past it, and we have so much more medical knowledge now. We can keep ourselves safe more readily than the last one. So I would say just remember it's going to end. Just be careful and be positive.
Thank you, Nicole.
Hey, you're welcome.
Introduce yourself.
Hi, my name's Sam. I'm a nurse in the ER.
All right. Hey, Sam, how are you feeling right now working in the ER?
I feel good. In Utah, at least, the it hasn't, fully hit us yet. We have, I think, just over 1,000 cases as of this morning. So it's not at that crisis level yet. We're not in desperate need of ventilators. The hospitals are still pretty empty, so that's still very nice. So right now things are good.
What about in a few weeks? How do you think it's going to be?
Depends on how many cases we start to get here and then how sick those people are that are getting COVID. But I think we could see more inpatient admissions and more widespread community transmission. But other than that, I think, what is it? What's the month? I don't even know. April, I think at the end of April will kind of be a big telling because a lot of people are supposed to go back to work mid to end of April here. So it'll be interesting to see if they reevaluate that and let people go back to work or continue to stay home and quarantine yourself and do social distancing.
All right. How do you think the world is right now?
Hard to say because I live in a little bubble, but I think we're doing the best we can. I would say definitely New York is hurting, and I think the world economy is going to be take a big hit. I mean, we're all out of work, and not out of work, but a lot of people are not working, small businesses. So I think recovering from this is going to be a lot more challenging than we initially thought. So yeah, I think it's not super great, but we'll see.
All right. And what do you have to say to the viewers watching right now?
Wear a mask, wash your hands, and get outside and exercise.
With social distancing.
Yes, that's true. With appropriate social distancing. But get outside, it's nice. At least in Utah right now, it's beautiful weather. Everybody's outside. All the dogs of the world are very happy. All their owners are home all day. So take them for walks, get outside. There's still fun stuff to do. Enjoy your time off.
And what about for the people that are supposed to kind of be
I'd say if you're actually
lockdown?
Supposed to be quarantined, you need to do your part to keep everybody else safe. Take care of yourself first and foremost, but make sure you're doing everything to keep everybody else safe. So if you do want to go outside or something, you do want to go on a hike or something, make sure you're wearing, a mask or something, or maybe go to a place that's much more remote where the chances of seeing other people are less likely. But take care of yourself and help take care of others and not spread it.
Awesome. Thanks, Sam.
You're welcome. Thank you.
Introduce yourself.
So my name's Don. I am an ER physician in Utah.
And how are you feeling right now working here in the hospital?
At the moment we're doing okay here. There is this kind of feeling of impending, the impending surge coming. So there's kind of this constant anxiety that's there. But so far so good.
All right. How do you think it's going to be in a few weeks?
I think we'll get a spike. I think we'll get busy as it kind of hits us. So I think we're kind of gearing up for it.
And how do you think the world is acting right now, or is in general?
I think my sense is that most people are trying to do the right thing. There are some people who aren't. I'm aware that some people aren't really isolating like they should. They seem to be a little bit blowing off maybe the seriousness of it, which is going to affect everybody. I think there are a lot of hospital systems that are working hard to take care of their frontline people, but I hear stories of people running out of equipment and who don't have administrative support in certain parts of the country, and so that's concerning. So I feel like the public at large can step up and do the right thing by trying to isolate and social distance, and I would hope that the public will also provide support for hospitals and frontline people to get the equipment they need to take care of us. So.
Okay. And what is your message to the viewers who are watching you right now?
I guess I would just say now's the time to kind of work together. It's going to take everybody, I think, doing the right thing. There's those in the front line, but there's people that support them from behind, and so hopefully this will bring us together, and I'm confident we can get through it.
Awesome. Thank you, Doctor.
All right, you're welcome.
Okay, introduce yourself to the viewers.
Hey guys, I'm Jen. I'm a critical care tech here at the hospital.
Okay, how do you feel right now, Jen?
I feel good. Just kind of hanging out, going with the flow.
All right. And then how do you think it's going to be here in the next few weeks to month?
I feel like it's gonna pick up a little bit, but we don't really know. People are sometimes staying inside.
Okay.
Not always though.
No? How do you think the whole world is reacting here?
They're not taking it as seriously as it needs to be taken at the moment.
What do you think they need to do?
Listen to what people in healthcare tell them. Like, I get it. We know we overreact or whatever, but we know what we're talking about most of the time. We deal with this all the time.
Okay.
People just need to get their life together a little bit.
All right. And what is your message? What do you want to tell people who are watching this right now?
Wash your hands. Please keep yourself safe, distance from others. Listen to what people are telling you if they know what they're saying. Not everybody does, but most of the people that work in healthcare usually know what they're saying, especially if we're telling you to stay inside and we're doing it. I would suggest doing it.
Okay. Thank you, Jen.
You're welcome.
Okay. Hi, I'm Seth. I'm a Utah State paramedic working on the ambulances around town.
Okay. And how are you feeling right now, Seth?
I'm feeling good. Being out in the EMS world, our like PPE and stuff is like super limited, which is like a worldwide thing right now. So it makes me a little nervous that like some of the equipment we're using is whatever it is. So it makes me a little bit nervous that like we're frontline and just up in front of doing stuff.
Okay. How do you think it's going to be in a few weeks, Seth?
I think in a few weeks, everything is going to get a little bit crazier, especially with our East and West Coast, the way that their systems are being ran and everything. Just like New York the other day took more calls than they did on the day of the 9/11 attacks. They ran about 71,000 calls in one day. And I think that is eventually just going to slowly start moving inland.
Okay. So you think it's going to happen here in Utah too?
Yes.
Okay. And how do you think like the world is acting right now?
I think that we've gone into a mass panic. I definitely think we need to be cautious of everything, but also I feel like we need to also like remain calm. Like I feel like most of these restrictions and things are probably putting things a little too far and just causing like mass panic upon like society itself. But I feel like if we all kind of calmed down and kind of did what we were told, everything would get a little bit better.
Okay, and what's your message to the viewers who are watching this right now?
To the viewers, please stay home. Please, please, please. If you don't have to leave for work or to get essential groceries and things like that, please stay home. This is super contagious. Anyone can be a carrier at this point because most people, about 50% are being non-symptomatic, which means you have no symptoms of it. You're just a carrier. So for the wellness of you, your families, people around you, please just stay home unless it's absolutely necessary to go out.
Thank you, Seth.
Thank you.
Hey, introduce yourself.
My name's Brooke. I'm an ER nurse in Utah.
And hey, Brooke, how are you feeling working here?
I feel great. We're handling it great. We have this.
All right. And how do you think it's going to be in a few weeks to a month?
I think we're going to be busier, but I don't think we're going to see the numbers that New York and New Jersey are seeing, for sure.
And why do you say that?
We don't have a population as high as they do. We're not as densely populated. I think we have, maybe it's also like the end of RSV season, so like the air's a little bit better. But yeah, I don't think that and we did the social distancing a lot earlier than New York did.
Yeah. And how do you think the world is right now?
I think the world's not super great. I think Italy kind of scared everybody. So did Spain. I think those are the true numbers. And that's been hard, but eventually we'll get through it.
And what do you have to say to everyone right now who's watching this?
Remain positive. It is working. What we're doing is working. Utah is doing great. I think it'll be hopefully June, or it'll be a lot better. Life will get back to some kind of normal, but I think that we just need to be patient.
Awesome. Thank you, Brooke.
Thank you.
Hey, introduce yourself.
Hey, I'm Ben. I'm a security guard over here at the hospital.
All right. And how are you feeling?
Right now, I don't feel too bad. Obviously, I'm aware of what's going on, and at times I might feel nervous or unsure. I mean, unsure is, I guess, a better word for it. I don't really know what's going to happen, but I think overall we can get through this.
All right. And then in a few weeks, what do you think is going to happen in a few weeks?
I think it's going to get worse. I don't think we've definitely not hit the climax of this, but yeah, I guess that's it. I think it's going to get worse. There'll be more sick patients, more chaos, but eventually it'll come down.
And then how do you think the world is doing right now?
That's actually probably what makes me the most nervous, because there are obviously a lot of other people who are very scared and acting out and buying up all the toilet paper, etc. The economy, that scares me, just because there's probably a lot of people, well, I know there's a lot of people that are hurting financially, and that really affects things. So that is the part that does make me pretty nervous, actually.
Okay. And what do you have to tell people who are watching right now? What's your message?
My message is you can't control everything in life. It's something I've learned, and it's very apparent right now. But you can do what you can to practice good hygiene, social distancing, etc. And really, that's all you can do. So just do what you can, have faith, and know that things will get better, because they always do.
Awesome. Thank you. Hey, Ben. So I'm just going to ask you some questions, okay?
Okay.
How are you feeling right now?
I feel great.
You feel great?
I feel that what we're doing is preparing for the worst, and I think right now is not the worst.
Okay.
But I feel good right now.
How do you think it's going to be?
I think it's going to be a lot worse. Is what they're telling us is that we're going to have like an influx of patients, and we're creating all these protocols and guidelines for that influx. We haven't received that yet, and I think that things are going to get a little bit more crazier and a little bit more busier.
How do you think the world is reacting right now?
I feel like the world has been reacting slowly to this. I feel like everywhere has taken proper precautions and put some protocols in place, but it's taken us a longer time to do that than what I would expect the response should have been.
And what do you think, if you have anything to say to people, what is your message?
My message would be, come in if you absolutely need to. That's pretty much it.
That's pretty much it? Thank you. Introduce yourself.
Hi, I'm Brian. I'm in imaging.
All right. And how are you feeling right now working in the hospital, Brian?
I'd say overall it's not bad, but it's frustrating. Like, things are changing all the time, so it's hard to keep up on what you're supposed to be doing.
All right. And how do you think it's going to be in a few weeks from now?
I'm torn. I don't know. I think maybe it won't be bad, but then I look at stuff like New York and it seems like it's going to be pretty bad. I think there's factors that could differentiate us. Like, we're nowhere near as close together as everyone in New York, so I don't think it'll be quite as bad as them. But
All right. And how do you think the world is right now?
we all need a vacation, I think.
I agree. And what do you have to say to all the people right now from all over the world watching?
Don't be an asshole and stay at home.
All right. Thanks, Brian.
Hi, my name is William. I am a pharmacy technician. How I feel right now is I feel pretty good given the current circumstances. I'm not really worried. I feel pretty safe working here at the hospital, and glad that I work here. I feel like I'm helping people too and stuff. It's just one of those things where, just especially during this time, I feel pretty good about it.
Great. And how do you think it's going to be in a few weeks to a month?
I feel like I don't feel like a lot will change really. I feel like it will probably kind of be the same. I feel like how we're handling things should help things out and should turn for the better, hopefully.
Okay, and how do you think the world is right now with everything going on?
I mean, I feel like there's a lot of people panicking and a lot of people worried. And so, I really feel like if we trust in each other, that we'll pull through really well.
And
So,
oh, sorry, but
oh yeah, that's it. That's
okay. And then, well, no, you're great. What are you gonna say to the viewers that are watching right now? What do you want to tell them?
I just feel like everybody just needs to have a community mindset instead of trying to help yourself mainly, and just think about the people around you and how you can help other people. And so, obviously with our certain circumstances right now, like, it doesn't need to be a physical way or anything like that. We have social media that we can reach out and do positive things instead of spreading panicky kind of information and stuff like that. And so, but use it for good to, like, you reach out to the people around you and to, see if they're okay and see what they need. And so I just feel like that's probably the strongest way we can pull together and just kind of, weather through this thing in a positive way.
Awesome, thank you.
All right.
Okay, introduce yourself to the viewers.
Hi, I'm Allie. I'm a nurse in the ER in Utah.
Okay, Hallie, how are you feeling during these times?
Good. I mean, people I know are stressed, but I'm more calm when I'm here at work because I already know that we have things in place that we're doing to kind of help our staff members and keep us safe and keep the public safe. So I actually feel more calm about everything when I'm at work. And I carry that at home with my kids, right? And try and keep them informed, but not to the point where they're panicking. So, just try and keep everybody cool, calm, and collected.
All right, how do you think it's going to be? What's your predictions for the following weeks, month?
I think we'll probably see an upswing in severe cases, not necessarily we already see people that are having moderate symptoms, and again with the testing, that skews everything. So I think we still have a lot of cases that are mild to moderate, but we'll probably see an upswing in the severe. But that's to be expected, So.
Okay, and then how do you think the whole world is acting, or Utah's acting?
I think the social distancing thing is just so we can flatten that curve. I know people have heard that term before, but it really is. So what happened with Italy was everyone was exposed at once, and the severe cases all hit at the same time. It's kind of happening in New York too, right? But if you think about New York versus Utah, all of Utah's population, put them on a mile radius island, that's what's happening in New York, and they're all exposed at the same time. Here we can be more spread out and social distance easier, so that'll flatten things so that our healthcare resources, I guess you could say, won't get completely annihilated, because we're gonna try and you'll see severe and then it'll kind of taper and then you'll see a little more severe, but it's not gonna spike like it did in Italy. You know what I mean?
Great. Now, what do you have for your viewers? What is your message to tell them who's watching this?
I know it's super hard to social distance, and I'm terrible because I am so social and I like to go see my family and my brothers and all of that, but the younger generation that's done all of the social media stuff, this is they've been trained, I guess you could say, so that you can do all of FaceTime, Skype, WhatsApp, you do your TikTok videos and all of that stuff and still social distance. And I know people want to go out to the grocery store and stuff, and I get it because we still have to eat and all of that. However, it's I know at least at my house, I have enough in my house right now that if I had to stay home for 2 weeks, I would be okay. It might not be exactly what I want to eat that night, but I still have food to eat. So you don't need to panic that you're not going to be able to eat anything. You know what I mean? Because you've got stuff. We're just so used to be oh, I feel like tacos, or oh, I feel like chicken wings. And so you go and get it. We can't do that right now. We have to just use what we have and stay home as much as possible, so that way we don't get hit all the time or all at once, because that's going to put us healthcare workers at higher risk and increased danger, because we are the ones that are still required to come in and take care of all these severe sick patients. And when we're worn out or we're sick, who is going to help you?
Great, thank you. Introduce yourself.
Hi, my name is Justin. I am a critical care tech in the emergency department.
And how are you feeling right now, Justin?
Not too shabby. A little anxious here and there, but pretty well overall.
Okay. How do you think it's going to be in the next few weeks to a month?
Probably a little busier. Hopefully not too bad. I feel like we've implemented a lot of policies, not just in a hospital setting, but also outside of the hospital setting in the community as well. So hopefully not too bad.
How do you think the world is right now? How do you think they're doing?
Personally, I can feel everybody panicking and very, very fear-based. And one thing that I've learned is when you come from a fear-based, you're not able to think logically. You do by instinct, and sometimes our instincts always lead us in the wrong decisions. So personally, what I've learned to do is kind of like take a breath, kind of chill out, and allow yourself to really like rethink and reanalyze things, because like I was saying, you just grab things, do it in the moment, and sometimes you're not always 100% right. So it's more of stepping back and taking time to really think things through completely.
And then what is your message to the people who are watching this right now?
Try not to panic. Like, yes, there's scary times. Yes, it's very high anxiety, very high pressure, and you want to make sure everybody's safe, but you can't make sure everyone's safe if you lack the compassion to make sure everyone is safe or check up on everybody.
Awesome. Thank you, Justin.
Oh, hold on, I forgot. I forgot to tell everybody to stay calm and wash your hands. Okay.
Introduce yourself to the people.
All right, so my name is Britta, working in the ER as a nurse.
All right. And how do you feel right now, Britta, working here?
I feel okay. Yeah, it's lots of changes and process changes, but I feel like we're ready for the worst, or ready for if it gets worse, and that we have a great team that's pulled together and been awesome. But yep, and just in general feeling a little anxious about bringing a baby into the world with the pandemic.
Yeah.
But other than that, pretty good.
All right. And how do you think it's going to be in the next few weeks to a month?
I think the worst is yet to come, and if you look at all the numbers and the numbers of positive cases are going up. So once we reach the peak, I think the worst is definitely yet to come, and hope that we've been proactive rather than reactive.
Great. And how do you think the world is doing right now with everything?
I think, there's been a lot of hysteria, or some people not taking it seriously as far as flattening the curve or slowing the spread. But I think in general, people are trying to do their part, or kind of getting the seriousness of the situation. And but yeah, there's definitely lots of hysteria, or more worried with the economy and jobs, things like that.
All right, and what do you have to say to your viewers that are watching you right now?
Viewers, all right, so you don't need extra toilet paper for all the extra poop. Because that's not a symptom of coronavirus. I'm just kidding. No, but make sure you wash your hands, especially after you take a dump. And also, this will pass one day at a time, and keep on keeping on.
Thanks, Rita. All right, guys, I hope you continue to watch my videos as the weeks go by. I will have at least a video every week, and I will check in with my coworkers and see how they're doing, so you have a little glimpse in the ED of what we go through. And right now, it's nice and calm, but a lot of us say it's the calm before the storm here in Utah. It'd be interesting to see in a few weeks how it really is and how we're feeling. In the meantime, I really do thank you for watching this video. Keep in mind that we are not defined by our money or material things. We are defined by our actions. What act of kindness did you do today?